Welcome back into Wave Listens Live. I'm Michael Vanover, filling in for Brian today, and joined by three friends of mine. Joining me from my left to the right here, Will Chandler, the principal broker at OneStop Health Brokers. Will, welcome in.
Thank you very much. Appreciate you. Thank you for having us.
Jamie Gibson, the broker from OneStop Health Brokers. Jamie, thanks for being here as well. Definitely. And Richard Lockhart, also a broker with OneStop Health. So first of all, thank you all three for being here today. Thanks for sharing your story and all the things that you guys are doing. But I'll start with Will. Will, for folks at home that are not familiar with OneStop Health Brokers, could you give us a little bit of background and exactly what you do?
Yeah, so I started in the insurance industry. It's been about 16 years ago now. I started off working for a major insurance carrier, got really good education, learned a lot about Medicare. That's kind of where I've been focused for the past 16 years. And in that time, I realized after about 13 years that I would be better off going off, starting a brokerage, being able to contract with a lot of the major carriers, so I would be able to help more people and not be as limited in my offerings. And so what I found is some other individuals. I have a couple of the brokers here with us today. So Jamie has a long background in customer service, so he's used to taking care of people, finding out their needs, and has also moved that over into the Medicare side to make that process easy for them. And then Richard Lockhart, he started off, he's been in nursing, and so again, he has a passion for helping people and has moved that over onto the Medicare side as well, to where he helps people figure out the needs and kind of what's going to be best for them plan-wise.
And we need people that like to take care of people, so that's good. It sounds like you guys are in the right profession. Right. Will, if you would talk a little bit about, there's been a lot of changes in the world, period, but what are some of the changes that people could expect in your sector in the upcoming year?
Right, so this is a big thing. We know Thanksgiving's coming up. Everybody's sitting around the table and they're talking about Medicare. I mean, that's what
just the topic, right?
I know. It's like that's the fun topic of conversation. So everybody loves it. Yeah, you see a lot this time of year, but a couple of the biggest things, because of the Inflation Reduction Act, that changed a lot of the carriers' plans. So how plans work this year, they're not exactly the same as they are next year. The biggest change kind of came on the prescription side, really. There's a cap on medications next year, a $2,000 cap. So how the plans are structured can vary between carriers and the formularies, and because of the changes made, there have been reductions in plans. So you have some people that have Medicare supplement plans and they have a separate standalone drug plan, and their options have been reduced. It's about half of what it was the previous year. So I would say in terms of the biggest changes, it's going to come on the prescription side, and so that's why you want to make sure that you look over those changes for your plan each year when you get it's called your ANOC, your annual notice of changes, and make sure that you review those for the upcoming year.
Jamie, what would you say to people that are on Medicare? What should they do each year as they're looking at everything?
Actually, a good question, Michael. On Medicare, whether you have a supplement plan, a standalone drug plan, Advantage plan, each year it's always important to review your plan to see what changes there are. Not only with your plan. This year it could have been that the plan you're on was great for you, but next year it may be that another carrier has a better plan for you. They should definitely always check each year review, and the best way to do that, obviously, is to reach out to a reputable broker. We would love to take care of you. In fact, there's a QR code where you can actually just scan and it goes straight to a form. Okay. Obviously we'd love for you to reach out to us at OneStop, but it's just very important to do that and review and check that each time. There's a lot of cold calls and pop-up caller. People are getting calls constantly, and so if you don't have a local agent, it's important to reach out to one, because the call centers in places may not even be anywhere near our state, and so it's important as a local broker. We know the doctor networks better, the local plans of the different carriers, and so it's definitely important to reach out to a local broker.
For sure. And if you would, Richard, talk a little bit about why people should use OneStop.
Well, I mean, all of us are brokers, so that gives us the ability to give an unbiased opinion, because we can offer all the plans available in your area.
Okay, yeah, that's great. And Will, is there anything else you'd like to add to that? Because I think the list is long of all the reasons why One Stop is the place to go.
Yeah, I mean, I think that it is, the big thing is the experience that somebody's going to get with us, the care that we take for each of our members. It's just not something that you're going to find somewhere else, you know, and that to me is the biggest thing. I try and treat everybody like I would my own family, so take care of my members and make sure that they're each in the best position as possible for the upcoming year.
Jamie, if you would, talk about, you know, how important this is to you and how much it's so nice to be able to help people. And what that means to you personally. And Richard, I'd love to hear your response to that as well.
Well, you know, as Will mentioned, you know, I've been in call centers for tech support, for different support roles within customer service, and actually I own and operate a construction company as well. It's still consumer-based, customer-based, dealing with customers, but I think just to come to fruition, I had some clients the other day, and I called Will afterwards, and you know, it's like I've made close friends with these people.
Right.
But you know, I was on disability at one point and had to navigate the same waters with Medicare and things, and so just knowing that I could reach out to somebody locally and get someone directly that's going to help me through it versus having a call center, pressing this button, pressing that button, you know. So I think overall, just what I had to go through, it's nice to be able to help people navigate through that.
Richard, do you feel the same way?
Yeah, I like having the ability to sit down with somebody one-on-one. I mean, come out, we can sit down at their kitchen table, we can go over their plan, I can show them all their options, and I can actually show you all the numbers, all your benefits. That way you know exactly what you're getting. You won't have any guesswork as to what you have, or you won't be wondering if there's a better option out there for you.
So Will, the people are probably watching saying, well, how much does an expert like this cost? What would you tell them?
Right. And I tell people a lot of times, you know, if you could go and get your taxes done and it didn't cost you anything to do, would you do that? Yes, you would. You do the same with your health insurance. You want to use somebody that's an expert in the field, and it's not going to cost you anything out of your pocket to do that. So give us a call.
That's awesome. Yeah, One Stop, 812-955-7850 or OneStopHealthBrokers.com. Gentlemen, thank you so much for being here.
Thank you very much.
And hope everybody has a great rest of the day. Thanks for joining us. We'll see you tomorrow on Wade Listens Live.